Our students learn differently, and oftentimes there are competing priorities to help them stay focused when they get to class, when they get to clinical, and when they get to SIM. How can we integrate more hands-on experiences to help all of our students learn at the same pace? Even though they may learn differently, they may pick up knowledge at different points throughout our courses. There are, though, some specific strategies that we can use to help our learners stay aligned and to help them meet our learning objectives. That's what we're going to talk about in this snapshot. Welcome back, everybody. If you haven't been with us before, make sure you go ahead and print the study worksheet that's listed right here in the description. This is going to help you stay focused as we move through these concepts during our time together today. All right, so first you want to print out that study worksheet. Second strategy is you're going to write down today's date, whatever date you're watching this snapshot. And then third of all, we want you to stay focused and connected with us. So turn off any distractions. I know many of you may be multitasking. Now, if you're driving and if you're on your way to work, totally understand that. But otherwise, we want you to stay focused and connected with our conversation today. And the second step we want you to take is, or the next step, is to go ahead and write down today's date and your learning objective. So, what is just one takeaway that you want to have at the end of our time together today, knowing that we're going to talk about specific strategies to help bring along all of our learners at the same pace, because we know some of them learn at a different pace, and it's important when we are leaving our learning experiences that we have developed for our students that we have confidence in knowing that students have this deeper understanding of knowledge that we need for them to have. All right, so first, what we want you to do now is, now that you print out your study worksheet, we want you to go to the NLN website. We're going to go there with you, and this is where we want you to go. So first, you're going to go to the home page. Okay, so that's nln.org. This is where you're going to find your study workbook. Well, actually, your candidate handbook, I should say. Not your study workbook. That's a different resource. Your candidate handbook. Okay, so when you go to NLN, you're going to go to the homepage of the CNE exam that you're planning to take. There are 4 exams that NLN now has available: CNE, CNE Clinical, CNE PV for our colleagues that teach in LPN, LVN programs, and CNE Novice. So you may wonder, how do I know which exam I should take? That's an excellent question. It's wonderful because NLN already has the eligibility for each one. Okay, so under resources, that's where you're going to find eligibility for every single exam. Okay, and now they have set up the website, so you basically have the same list of resources in the same area for each of the home pages. Okay, so that's step one. Determine which exam you're going to take based on eligibility criteria, and then print out that candidate handbook. Once you open your candidate handbook, this is where you're going to see the specific detailed test blueprint. Okay, so you can see right now I have CNE open. This is where you're going to identify concepts that you need to focus on. For our conversation today, you're going to be able to align it across several different subcompetency statements. However, I want to keep you focused. So you are going to look at alignment with competency 1D, using technologies to support the teaching learning process. Okay, so that's what we're engaging in today. How can we create more hands-on experiences for our students to help them learn? We're also looking at G, 1G, creating opportunities for learners to develop clinical judgment. If our students don't have strong clinical judgment skills, they are going to struggle in our curriculum. They are not going to be successful on the NCLEX exam, and ultimately, they're not going to be able to provide safe patient care. Okay, so again, our conversation today aligns with competency 1D as well as competency, just for a few, again, there are many others, and competency 1G. And then for C&E clinical, because I wanted to expand, usually we just focus on C&E. However, I felt a little different today that we need to show some specific support for our C&E clinical colleagues that are on that journey. Our conversation today aligns with competency 1A3, using technologies to support clinical teaching and learning. Again, there are some other elements that definitely align with our topic today. including preparing learners for clinical experience. Okay, so let me add two. Okay, so two for CNE clinical as well. That's going to be 1B4, preparing learners for clinical experiences, facility clinical expectations, equipment, and technology-based resources. And the other competency, you're aligning it with 1A3. Okay. All right. So now that we know which competencies we are aligning our conversation with today, I want to share another resource with you, and then we'll be ready to go to our content for today. All right. So the next resource I want to share with you is going to be directly from our homepage. When you're on this journey to achieve your CNE, we know that sometimes it can become overwhelming, okay, but we don't want it to. So we just want to share some resources to help you decrease your cognitive overload as you're thinking about the next steps you're going to take. When you go to our homepage, that's drsellarseducate.com, you will see all of the resources that are available to you to help you on your journey. Now, we know colleagues are at all different points on their journey. This is why our homepage is so helpful as a consistent resource because we're updating content with our snapshots on our YouTube channel that some of you are watching right now, or you may be listening to us through one of our podcast channels. This is where you're going to find consistent support. When you partner with us, because that's what we consider our colleagues partners, or maybe you're a university or a college that's partnering with us to help you achieve excellence. That is the goal, that it's a continuous journey, that we're all moving forward in closing our knowledge gaps and strengthening those competencies that we just looked at. All right, so you can see there's a link right here to our YouTube channel. There's also an excellent resource, which is the Nurse Educator devotional. It's called Rooted in Wisdom. This is a way for you to stay connected to your why. The goal is that it is going to uplift, empower, and equip you all with wisdom, purpose, and reflection. The reality is we do a lot of hard work and we have impact on hundreds of thousands of people and their career for the rest of their life. Take a minute to reflect on your why and remember the impact that you have on others. That is the purpose of that Rooted in Wisdom book. And then CNE in 60 days. I just wanted to bring you all to this website because it only takes 60 days to achieve CNE success. You can see we have identified, based on your request, specific dates already through 2026. Okay, so again, the purpose is really for us to take a look at all of the resources you have available to you as you move forward on your journey. So that way you don't have to worry about getting stuck, right? All right, so in front of you, you have your study worksheet. You've already written down the specific competencies that our conversation aligns with. You put the date on your study worksheet, and you also have an objective. Now we're going to take a look at our actual content that we're going to be exploring in our conversation. Remember, we also have a thought-provoking question. The purpose of that thought-provoking question is to stimulate thought. Okay, so we do have that as part of our conversation today as well. The role of simulation is our focus for today. Technology is important. As we know, our students, when they graduate, they are going to be engaging with different types of technology. Our goal is to help our students get ready, helping them feel confident in their ability to provide safe patient care. So how can we do that? Simulation and experiential learning. This is a great way for us to integrate clinical knowledge into a formative experience where students are getting feedback for learning so they can modify decisions that they make, or maybe they need to spend more time in the skills lab practicing some of their skills to increase their competence and their confidence. As a nursing program, when we are investing in supporting students to close those knowledge gaps, increase their competence and confidence, what we're doing is we're looking at simulation expansion. We already see that happening throughout many colleges and universities where they are realizing the value of simulation, engaging in those hands-on experiences frequently. So students have many iterative experiences related to a skill. Virtual clinical learning is another great example. We have many vendors that offer virtual simulation to allow students in a non-threatening, non-intimidating environment to practice those skills that they will need once they get into that clinical setting. Another investment we're seeing is competency-based experiential models. Some universities are moving to a competency-based model that will allow stronger validation throughout a course of competency. That's what we're looking for. We want to make sure our students have this deep comprehension of concept that will allow them to make patient care decisions, right? To determine what behaviors they are going to demonstrate, clinical decisions they are going to make related to a specific knowledge area that they need to be able to demonstrate. Okay, a good example, sterile technique. That's the one I like to use. We want students to know exactly what behaviors, what steps need to be in place in order for us to decrease our hospital-acquired infection. We know competency really is the key to our learning journey and helping students progress in their knowledge level. Technology-enabled learning environments to address workforce and clinical placement limitations. Okay, so that is the overarching purpose. We want our students to be better equipped clinically with the knowledge they need as they are making those patient care decisions. And we don't want that first opportunity to be whenever they get to the bedside of an actual patient. So again, why are we investing in simulation? Well, because we know the role of expanding our sim lab, because students may need to have more simulation experiences. The virtual learning option, specifically for clinical skills, competency-based, as well as using other technology-enabled learning systems, such as ebooks. And then we also have exit exams, we have specialty exams that can all be completed using technology. We also are embracing opportunities for students to have these interactive hands-on clinical experiences. Malcolm Knowles talks about the importance of self-directed learning as an adult. David Cope talks about the importance of those hands-on experiences to validate that learning has actually happened. We also want to bridge that theory knowledge, that theory practice gap that Patricia Benner talks about. We can do that by bringing clinical experiences into the classroom and creating these real world scenarios so students can actually have more practice walking through them. Just to clarify, let's talk about what is the value of integrating simulation into our nursing program. Safe learning environment. Students can sometimes be intimidated, right? When they get in a room, especially for the first time. Sometimes the fact that they're in front of a real patient can simply cause them to shut down. They can't even process information. They can't even think about the steps they're going to take because they're so overwhelmed. Immediate feedback is important. That's that formative feedback because we want students to be able to process the feedback we give them in a way that allows them to make a different patient care decision. Repeatable practice, that is having more repetitions, having more iterations, more experiences that allow them to sharpen their skills. IVs is a great example. IV number 10 was a whole lot harder than IV number 50, usually, right? So just think about the value of repeating the same practices and how it helps us really provide safer patient care. And it also builds confidence. The opportunity for students to practice allows us in a non-threatening environment to give them that hands-on experience without having that direct patient care, that human in front of them that can immediately cause intimidation at times. So what are the types of simulation? Well, there are lots of different types, but specifically what's most important to know to help you get ready for the CNE exam is that simulation helps to supplement the clinical learning experiences. All of the different types, they offer unique benefits that we are to align with those clinical competencies and skills. Okay, so that's the important part. When we decide what simulation strategy or the simulation format that we're going to use, we just have to make sure that there's strong alignment in meeting our learning objectives and clinical competencies. Okay, so that's where we start. Digging into the nitty-gritty details, this is not information that you must know when it comes to the CNE exam. These are the details that are nice to know. Okay, so what are some of the types? High fidelity mannequins, standardized patients, virtual reality, and task trainers. These are all different types of simulation that support the learning process with our students. We also want to think about what are our learning outcomes? What are the specific behaviors that we are expecting for our students to be able to demonstrate and achieve as a result of the simulation experience that we have developed for them? Number one, we expect that students will have improved clinical judgment, their ability to make safe patient care decisions by recognizing that something's not right, gathering data, making a decision, reflecting on whatever decision they made, whatever next step they took, and then reflecting on what they could do differently next time. Another outcome is that it will enhance teamwork because many of these simulations are in group format. And so our ability to engage students, to encourage them to engage themselves as a group, to plan out what those patient care decisions are going to be is a really important outcome and a really important skill for our students to be able to master. And of course, better patient safety awareness. Our goal is that this will increase our students' ability to have patient safety awareness. We talk a lot about our students being patient care ready, right? But however, we want to think about them having greater awareness to realize when something's not quite right and when they need to take a further step to proactively reach out to our provider or to call in another nurse to say, you know what, I'm not sure what's going on, but this, my patient just doesn't look right. Even when the vital signs look good, even when we've done our head to toe and we can't put our finger exactly on it, but we know something's not right. This is when we want our students asking questions and us working closely with them to help them identify what their next steps are going to be. All of these strategies with simulation, with giving that formative feedback in real time, help students have stronger clinical judgment skills. All right, so I know that was a lot of information, but stay with me. Okay, so take a couple of deep breaths if that was a lot. Remember, you're writing down your one takeaway and you're thinking about what your next steps are going to be to take a deeper dive into exploring these concepts so you can pass that CNE exam and become a better nurse educator. Our thought-provoking question is aligned with, you guessed it, clinical judgment. Our scenario in this STEM and then our question you see on the screen right now. Okay, so I'm going to read it to you and then I'm going to unfold each of the answer options. And then you're going to go ahead and write down your rationale for the correct option and your rationale for the incorrect option. Okay, both are equally important. A 65-year-old male patient with a history of diabetes and hypertension is admitted to the medical surgical unit with complaints of chest pain and shortness of breath. As a nurse educator, you're supervising a student nurse who is caring for this patient. How does the nurse educator's nursing experience contribute to the development of clinical judgment in the student nurse? When you get to the CNA exam, two thoughts. Number one, what is this question really asking me? Number two, what is it that I know for sure about concepts included in this question? A, describe the steps the nurse educator should take to guide the student nurse in assessing and managing the patient's condition, highlighting the importance of nursing experience in clinical decision making. Again, think about your question. How does the nurse educator's nursing experience contribute to the development of clinical judgment? So, what action steps can the nurse educator take, leveraging their expertise, their knowledge as a nurse educator? What should their next steps be to support students' development of clinical judgment? B, compare and contrast the approaches of the nurse educator and the student nurse in assessing and managing the patient's condition, emphasizing the role of nursing experience in shaping clinical judgment. Or C, by explaining the theoretical concepts of clinical judgment and nursing experience, illustrating their application relevant to the patient scenario, and discuss how the nurse educator can effectively transmit this knowledge to the student nurse. Okay, when you get to the CNA exam, there may be some wordy questions like this one. Don't let that distract you. Okay, stay focused in looking at exactly what that question is asking, which concept you're being tested on. Just wanted to share this question again with you all. Feel free to pause this video and come back if that's what you need to do. All right, so if you chose A, you are correct. Describe the steps the nurse educator should take to guide the student in that assessment and managing the patient's condition. This is how our experience as a nurse educator can truly help develop and advance the clinical judgment model with our students. We want to talk about real life examples, helping our students kind of navigate their way regarding safe patient care decisions and the impact that those decisions can have on our patients. When you're moving forward on your journey, just like in patient care that you see happening in this video, we know we have to work as a team. Having a consistent community is going to help you achieve that passing score on the CNE exam, and also help you boost your confidence and your competence as a nurse educator. At Dr. Sellers Educate, our mission is simple. It is support all nurse educator colleagues on the journey to achieve excellence in the classroom and to achieve that passing score on the CNE exam. We hope that you have enjoyed this snapshot, and we look forward to seeing you in a future one. Have a great one, everybody. Take care.